So welcome everybody to this masterclass, which Michael Friebe will provide on his new book, Novel Innovation for the Design for the Future of Health. Great that, well, at least 6 people could make it here. There were some more registered on the marketplace opportunity. Maybe they will join later on. But we're going to record this. It will be available to the OpenExo community and also Purpose Alliance community. And I hand over to Michael Friebe. Great, you're here with us tonight.
Well, thank you very much, Oliver and everybody else here. So we had some fun sessions already with Stefano, who I very much appreciate. Stefano, I should say this one more time. I will follow up on this later on too, because I think that you and I have quite a bit of fun doing these little test sessions for the OpenExo game. I make a little advertisement for the OpenExo game here too, because I think I'm a little sad that not that many people are part of this, and I think there should be significantly more. I think it's a very worthwhile introduction to the EXO ideas, concepts, and so it's quite a nice onboarding challenge. But today I would like to talk about the book, and obviously this is a marketing event, right? I would like to everybody to buy this book. It's a very expensive one. I can tell you up front, I don't make any money on this one. It is a science book and a teaching book, so it will probably be provided to pretty much everybody for free at the end of the day anyway, with an electronic package. Springer is very generous with those things. The university have to sign up, and then they are basically able to sign in for free for the packages and download them. So, but I did this book, and I think that's the main thing I want to communicate in this round here, because I believe that there is a huge need for rethinking healthcare, and there's a lot of issues with healthcare that really would require to completely rethink the business model, the way we actually think about health, the way we act in healthcare, the way we see it for ourselves. And so if we don't really start rethinking the entire process, we probably will not get to a point that will really cause change. And healthcare is one of the few businesses, if you want to call it a business, on this planet, where the patient is really not the one who is actually in this, or should be in the center of attention, is really not part of this entire process, really. Yeah, if you're sick, you go to the doctor sends you to a specialist, the specialist maybe to a hospital back to your general practitioner, and data exchange is a nightmare, and you're kind of like handled like a good. You move from one place to another, and everybody seems to make money with you. I'm not saying that they don't want to do you any good. This is not what I'm trying to say, but what I'm trying to say is that it's not necessarily always done with the patient in mind. And I think we need to, particularly when we also think about how would we think about healthcare provision in lower income nations, we need to rethink this whole process. So having said that, as a motivational point, I'd like to actually start with a presentation. So you should see my screen now. And I'll start here with the recipe, right? And this is a recipe that I kind of like used as a title for a talk that I gave on the Purpose Alliance, on a Purpose Alliance book event. And so let me just read it out to you. I mean, everybody can read themselves, but I want to explain something with that. Frugal disruption. So first of all, we need to define what frugal disruption is. But I believe that, a focus in the future healthcare developments and innovations that have a high focus on dramatic cost reduction will be an essential goal that we need to follow. I also believe that entrepreneurship will be essential. The large companies, to a certain extent, I'm not blaming them really, but they're trying to protect their own business at the moment. I would do the same thing if I would be them. But if you really want to do some frugal disruption, and you would like to provide tools that have a disruptive effect and maybe a transformative effect, you need to stimulate entrepreneurship. I think that entrepreneurial efforts, and they are the only ones that can really change and transform things as they are at the moment. And we obviously need to have an innovation framework. And so part of this book has been that we adapted the Purpose Launchpad, which I and probably several others on this call believe is a very ideal and a setup for looking at innovation development from a in the case of the Purpose Launchpad, we have these 3 phases of exploration, evaluation, and implementation. So first of exploring an innovation space and a problem space, and then actually not forgetting about checking whether that really has a use in the healthcare model. And only if you do these things together, we'll actually be able to develop something that is a sustainable and also effective and democratizing healthcare. And we will talk about sustainability in a second as well, because I want to show some pictures on that one as well. So the book, here's the cover page on that one. I want to quote on this one. Let me just move this here so that I don't see my own stuff here anymore. So the book starts with a quote from Captain James T. Kirk, known to everyone in this on this call here as well, right? You want to do this here? That's right. Spock's that we are actually trying to maintain most of what we know, most of what we have, and we are a little bit afraid of things that may come in the future. And every time you put the word disruption in your mouth, at least the people that are a little bit familiar with these developments, they know that that will cause some form of chaos. It will also cause new business models, and it will not be the same like it is before. A lot of people don't like that because they just simply don't know what might happen. And that's a little bit of this voyage of Captain James T. Kirk not knowing what would happen, but we need to do it anyway. And I think it is needed for this planet, as well as for the population on this planet, that we make healthcare affordable and available to everyone. And we have another issue, and maybe that up front, I don't believe it makes a lot of sense if we increase the life expectancy of everyone to 120 or 150, while we at the same time destroy our planet. And that's what we do right now, right? I mean, we're all aware of that. We are not doing enough, I believe. But if we continue that way, we may end up, increasing the healthy life expectancy significantly, but only for very few people on this planet, maybe in these nations that are not that dramatically affected by the global warming. And in some other places, it will cause dramatic negative effects, what we do. And why am I saying this? Because healthcare is embedded. Healthcare also is a major source of CO2 pollution or consumption. I have some numbers on this one later on. So we have a lot of other issues that are, going side by side. The health care innovation space. We have demographic issues. People get a lot older. We know that. So that also has an effect on healthcare, right? There will be much more people in the older segment requiring healthcare, requiring other attention. We have associated workforce problems. I mean, this is very weird to me at the moment when you look at all the effects of Corona and all the effects that we had in our own economy. And now we have the issues of not having enough labor. They have somehow switched. They're not unemployed. They're somewhere else, right? And they have left areas that come with particular psychological and physical stress, and that maybe are not rewarded appropriately. And healthcare is one of them. So a lot of people have actually left the healthcare space. So we have major issues there. Again, I mentioned already, we need to achieve climate neutrality. If we don't take care, if we don't watch out what we do in the healthcare space, we will not reach that goal. When you are actually dealing in certain countries, and I'm obviously most familiar with Germany, you will find out that digitization and using digital information to not only make an analog information digital, but to actually take advantages of what the digital workspace, the metaverse, and other things, artificial intelligence bring you. We are far behind in the healthcare space, and I'll see in certain areas on this planet where the healthcare per definition is not as good. a much higher attention and a much higher willingness to adopt digital tools. And that, again, goes back to the stakeholder problem that I talked before. And we also have, I think that's a major issue that we're dealing with right now. We have a lot of geopolitical issues. See what's going on in Iran. Look what's going on in the US also with the political instability to a certain extent. Look what's going on in Ukraine, Russia. There's a lot of geopolitical issues that we also have to deal with, and that come alongside, these change efforts that we want to do in the healthcare space. And there's an expression that's called planetary health, or One Health, where you need to see that health is actually embedded in a lot of other things. It's embedded into socioeconomic effects. It's embedded into the climate change. It's embedded into making sure that life on this planet, not only for the human, but for the animal and plant space, is maintained. There's a lot of drivers for that one, unequal accesses, demographics, lots of other things that are actually causing some negative effects, like not having enough fresh water access, and maybe the air quality is bad, some other things. And all of this has a huge effect on the health, on the individual's health, on the planet's health, and on population health. And if you look at all these issues, it's sometimes mind-boggling, and that goes for everybody, mind-boggling that we deal with, these minor issues with, making sure that people live a year longer or 2 years longer, while we could, with the same amount of money and effort, possibly, save or create a lot more effect and impact on the population of this planet if we actually try to attempt to do other things. For example, making sure that everybody has enough money on this planet. Just going back a little bit to the CO2 consumption, because it is something that people don't think about, but the healthcare space in the US is responsible for about 10% of the total greenhouse emissions. That's a lot of stuff, and I'm not sure that most of you were actually aware of that. I wasn't sure. I wasn't, before I actually looked at these numbers, wasn't quite sure, or wasn't quite aware that is such a high number. Globally, it's a little lower. It's about in the order of 4.5% to 5%, but still 5% is 1/20th of all the gas house emissions that we produce on this planet are actually coming from efforts in the healthcare. And if you look at all the consumables, consumptions, disposables that we have in healthcare, you may understand that a little better. So in essence, what we need to do, if you look at health and innovation in health space, we need to look at a lot of different issues. Obviously, this book is not covering most of those. We're not going into ecology. We're not going into the molecular microbiology issues. We're going a little bit more into the health economics, addressing some things that we need to do to improve human medicine and individual health, but not actually covering all this space. And that is something that is part of the first chapter, the first couple of parts of this book, where you really need to get into understanding what all the issues are. And I think that's a very important starting point, because the entrepreneur in all of us will be able to actually come up with some solutions, and maybe solutions that are a little bit more disruptive or a little bit more transformative than what we're trying to do generally. So I also use the intentions of the United Nations in their Sustainable Development Goals, and in this case, number 3, which is good health and well-being, as a general goal for everyone on this planet, at least from an activity point of view and from a government point of view, political point of view. So that should be a major goal for every government, is to make sure that the population, their own population, is in good health and well-being, and improve that. For that, we need to refocus medicine on what we call the P4 medicine, or 4P medicine. So 4 Ps for prediction. It would be obviously much better for all of us to know when, if there's a certain disease pattern that could develop with an individual or with a population, and do something before it actually has a major effect. That would also lead to prevention. I mean, that's a really nice word to say, prevention, but think about, and I'll have a number later on, when are you really personally doing something to prevent a disease from happening? You typically go to a doctor when you're sick, but not, can you do something for me to prevent for getting sick? That's not what the healthcare system is all about at the moment. It also needs to be personalized. So it's not that let me have like a little bit of a standard scheme that all 55-year-old male people are treated the same way, or kind of like considered the same, being the same. No, it needs to be personalized to my individual behavior. We are to a certain extent, we are machines, but we are completely individualized machines, and everybody has a different building system. Everybody has a different kind of like oiling system, right? Or reason why they run well or not so well. And you cannot really generalize that. But that's what happens in medicine quite often, is this generalization rather than a personalization. And on top of that, and that's the fourth P, we need to make sure that everybody actually thinks about their own healthcare system, participates in it, rather than being kind of like passive. That's actually another P, I'm thinking about it, passive. So it's not passive. So not sitting back and waiting till something happens, or oh, they'll fix me anyway, right? I go to the healthcare system and they will take care of me. That's not what will happen. And we need to combine this with development processes. So this is something that, you know, the innovator has to work on, as is kind of like the value proposition or the features that anything new in this space should have. It should obviously improve the outcome. Of course, we don't want to have things that actually are not improving the outcome, but it at the same time also needs to consider the experiences that the individuals and the clinician have in that healthcare system in providing that healthcare. I said at the beginning that there's a lot of people who left that space because there was too much stress, too much physical or psychological stress, and we need to improve their experience. They have too much to do with administration, too much to do with things that have nothing to do with providing healthcare, and that is something that a lot of people are not very happy about. Obviously, the patient should feel that he or she is in the center of attention, that everybody takes care of them, and not only tries to actually maximize profit on dealing with, treating or diagnosing and treating their individual disease. But what is very often forgotten about this is that if we don't look at lowering the cost, we will never be able to actually reach disruption. And for people that are a little bit aware or familiar with the theories behind that, only if you think about a 10 times reduction in certain things, you will rethink an approach. So if somebody is being asked to improve something by 10%, you will take whatever is currently done and you try to find some parts that can be improved to reach the 10%. But if you talk about 10 times, maybe even 5 times, you need to completely rethink that process. And if we really need to think about a dramatic cost reduction in healthcare system, we need to question on what we have at the moment and question whether that's the right setup or not. And anyway, if you do these things and combine them with environmental responsibility, with a social commitment, with economic stability, then we will actually have the whole picture of human health. It's not only having a good doctor, a good diagnosis, and a good treatment. It's a lot of things that are leading to good health and well-being. So the question is on whether we as innovators in that space or potential innovators are actually working on that. Are we working on actually focusing on prediction, prevention, personalization, participation? Are we focusing on traumatic cost reductions? And I can only tell you from most of the institutions that I know, no, we don't. We look at incremental innovations, making a 3 Tesla MRI scanner a little better, without asking on what the effect for the patient is when we do this. And the answer would probably be none. It's maybe nice for the radiologist to have, but it has no effect on the patient treatment. So a lot of things I've said already. That's why I want to go over this. Anyway, it's a very crowded slide anyway, but it's, by the way, it's something I sent it to Oliver already. So whoever wants to have this presentation, I provided a PDF to Oliver, who can then send it on to whoever wants to have it. So there's a lot of issues that I already talked about in the individual health. And please note this one red line that I put down there. Healthcare provision itself is only responsible for about 15% of the reason why somebody is healthy or stays healthy. The rest comes from a lot of other determinants that have nothing to do with the quality of the healthcare system. And there's a lot of issues that we have to deal with from depending on the region and country. We're talking about precision medicine, value-based medicine, patient-centric medicine, a lot of complicated expressions. They will all actually be explained in the book. But the question is on whether those are the real good approaches to actually change health from being a diagnosis therapy-based operation to a preventative and prediction-based operation. I personally doubt it. That's why I still believe we need to rethink this. And there's a lot of other unresolved issues that we will never address with any of these new approaches, precision medicine or value-based or patient-centric medicine. We'll still have unequal access, which I believe can only be solved by having what we call the democratization of healthcare, have actually tools available that have a completely different cost basis. We'll have a lot of issues with respect to quality of healthcare. I mean, if one person does a treatment in one country or in one place, it may be completely different in the outcome than in somewhere else. So that's education purposes. There's a lot of standards missing. There's a lot of duplicated and unneeded medicine. And healthcare, believe it or not, but mistreatment or wrong treatment in healthcare is the third leading cause of death. And that's also something we should think of. So healthcare is not always helping. It's also sometimes damaging the health of patients because of this.
Michael, there was one question from Suman. He asked, which country healthcare system are you using as a baseline? Maybe
I have really no baseline on this one. I typically jump back and forth from so Suman is actually right in a certain respect. I looked a lot at how we actually dealing with it in the high income nations because we believe we have the top healthcare. And to a certain extent, it probably is true that we have a good healthcare system, but it cannot continue that way. And I believe, and that's where we go back to lower income nations, that at the end of the day, lower income nations have much easier ways to introduce new thinking in healthcare innovation. They have a much higher need, particularly with respect to cost, and possibly will be the ones who will take over with respect to digitization, implementing digital health tools, implementing tools that are not necessarily needing a doctor, because they have these rural, urban issues, they have the inequality issues, and that's why I believe we have to focus in a lot of aspects also on thinking of how can we provide health to lower income nations and benefiting everyone on this planet. I'm not sure, Suman, that this answers the question, but I didn't really use a base for comparison. I just looked at global aspects, a certain aspect.
No, it does. I mean, essentially what I was looking at, there is quite a bit of variation even among the Western economies, let's say Europe. Yeah. I'm sure the NHS UK is fairly different from, the system in France or in Sweden or whatever. Yeah. And unless we talk about the US, perhaps that's better because, their spend is like 18% of GDP and they are on the WHO index, they're at some 45 or 46 rank. So, what all that I'm saying is the healthcare system varies so widely.
Absolutely.
And it's so inefficient, and the inefficiency kind of, it stretches from one extreme to the other.
Yes. Yeah, we focus on a lot. We focus also on the wrong thing, on the wrong aspects. And actually, maybe this slide I have right now is maybe a good example of that one. We have diabetes, which costs 500 billion globally. We have cardiovascular disease, which costs 863 billion, going up to 1 trillion, et cetera, et cetera. Those are some of these diseases we are treating the actual effects, but we don't treat the costs. Mm-hmm. And diabetes is not for everyone. There's also genetic issues, but a lot of them has to do with obesity, has to do with wrong food intake, with not enough exercise. There's a lot of underlying factors on that one. We could avoid diabetes, maybe not completely, but to a large extent. and could then actually save dramatic costs. So we are treating the effects rather than the causes, and that's a major problem in a lot of countries. And you're absolutely right. That's why I'm also saying that participation and personalization is important. Personalization, because the Indian setup is different than the US setup, and we need to actually deal in India with the Indian problems rather than trying to copy, or the Indians trying to copy the German way, the US way. That's maybe not working, because you are eating differently, you're behaving different, maybe the air is different, the water is different. There's a lot of issues that need to be individually treated. That's also something which I believe is hopefully part of this book, is that don't necessarily follow the high income nations because they don't know it all better either, but try to actually find your own way in certain aspects. So anyway, so some of these things are major problems, but we are not really going down to the costs. And that goes in a lot of ways with many other diseases as well. I think I have another chart later on where I say there's basically 8 conditions that cause 20 diseases that could always basically be responsible, are responsible for 80% of the total cost that we incur in this healthcare system. So have a little jump over to the Purpose Launchpad. Some of you who are familiar with this concept know that Francisco Palau came up with these 5 Ps, and putting profit pretty far down, which I think is the right thing to do. If people just think about profit first, which happens in the healthcare system quite a bit. We do things because there's a business model. We do things because we have reimbursement for these kind of things, but not necessarily asking on whether we really benefit the planet, the people, and very often not having a purpose. And particularly for healthcare, I think the purpose has to be the guiding principle. We would like to actually make healthcare more affordable. We would like to make it better. We need to have a purpose of giving healthcare to everyone on this planet, rather than to continuously develop things that only are benefiting the top 1% of the population because they can afford it. And we also need to, think about the planet. I mentioned that before. The CO2 consumption and the One Health and planetary health concepts are all intervened and intermingled, and we can't do things anymore in healthcare, but also in other industries, without thinking about what the effect is on what we do on the planet. And we need to have a profit. There's no doubt about it. If we don't have that, we have no motivation as a company. We have no life expectancy as a company or as an institution. But it should not be the guiding principles. We only do things because they bring us a profit. We only do these things because they bring us a higher profit. That's very dangerous. So going back to this one, I added, because I thought it was kind of cool to have 5 Ps on the positive impact pyramid. I added another 5th P to the P4 medicine, and I call it the prolonged health. So all the things that we should do should also have a benefit to all of us. Not only that we are living healthier, but we're living healthier and longer at the same time. And so that's my P5 medicine. And I have several chapters in this book that talk about healthy longevity, talk about things that we need to do. Actually, interesting enough, also about space medicine, because space medicine has something to do with aging as well, has something to do with low-cost approaches. So there's some interesting chapters in this book, and I'll have an overview on this one in a second. So talking about this prediction prevention, this is a funny little picture there. I ran with some other people. I ran a cartoon event, like a future story creation event, and then we focused on exactly these 4 topics, and that was very interesting, the stories that came out of it. And it is an indication of that we have to look in the future rather than to live in the present and try to improve things in the present. We need to think a little forward of what do we like healthcare to be in 10 to 20 years. And a lot of this current stakeholders are not doing this, are not really also that interested in it. And that's also seen in the fact that I don't want to call it developed world because that's a really bad expression, but let's call it the high income nations. There's mainly, most of these nations that are in here are European nations, because I think I had the numbers for that. It is not much better in the US or in Canada. It's not much better in Australia and Japan, and possibly maybe even better in India and China, because the total expenses are not as high. Maybe prevention has a higher value there, but in total, it's about 3% of the total healthcare expenditure. If you just think a little bit and say, ooh, if we would actually spend more money on prevention or prediction of events, how much money and how much effort could be saved later on? Because a lot of these diseases are having a time effect, and they have an effect based on living wrong or being in the wrong environment, and maybe not identifying the disease early enough. So there's a lot of things that we could achieve by doing this, but the question would be, what is the business model behind it? And those are difficult questions, and we need to think about how we can shift some of the monies maybe from left to right, or maybe open up a new value chain for these kind of products and services. And I'm just throwing this out here. This is just a nice little chart that was done by one of my friends, Professor Goyen, with GE. They're playing around also as companies and looking at healthcare. So it's in everyone. Everyone is talking about it, and everybody seems to understand that there is a transformation of healthcare necessary. And there's not only a transformation of healthcare necessary, but it needs different types of innovation. So not the kind of innovation that we have right now. And we need to actually also deal with the individual as someone who is part of their own healthcare provision and healthcare monitoring. And these are the things that I think are stimulating, because they give an indication where there is innovation potential available. So I firmly believe if we don't think about disruption, and I have to say at the same time, disruption is sometimes a bad word if you look at it from the financial perspective. If you talk to venture capitalists, you talk to people who are in this space, they say, disruption, we don't like that much, because disruption is this unknown, this chaotic thing. We don't really know what's going to happen, and that's why we don't like it, because at the end of the day, we'd like to, even though we call ourselves venture capitalists, we like to de-risk our business approach. We like to only invest in things that are somewhat safe and sure from a money-making perspective. Now, if you just listen to that, you have to say de-risking, and not being interested in disruption, not being interested in transforming something that is not good right now, to me is not a purpose. Just making money and maximizing profit is not a purpose. It is a personal goal, but not a purpose. And I further believe that, and that's not only with healthcare, it's a lot with other spaces as well. If you don't look at cost reduction as the most important or one of the major drivers and major value propositions for future developments, you will not be able to actually change and transform markets and change business models. So most of the things that I was looking at in the healthcare space particular is something called frugal innovation. Frugal innovation is where you actually have technologies available, you have business models available, but you are actually trying to achieve very similar results, maybe let's say 90%, for example, but with a cost reduction of a factor 10. So you pay 10%, you get 90%. Rather than you get 99% and you pay so much more that only these added 9% only benefit a very few people in this planet, but it dramatically increases the cost that is associated with providing this type of service. I think MRI is always a good example. You have a 3 Tesla MRI, big thing that basically is made to cover the entire body from the head to the feet, but at the end of the day, doesn't require the same amount of resolution time as well as spatial resolution for all these parts. Some parts you're quite fine off if you would only have 70% of the resolution. You would still see enough to do a diagnosis. But we have this big thing which is very expensive because we are dedicating it to the entire body rather than maybe being a little bit more specific, which will also reduce cost by providing a smaller system. So talked enough about disruption. That's why I think you can cut on that. Disruption to me is intentional intervention. So it's not something that happens just by accident. You really would want to. There's lots of technologies out there in healthcare. A brain-computer interface may be the weirdest one of them. Robotics out there. We have obviously AI, virtual augmented reality. We have all kinds of apps. We do 3D printing. Question is, how do we combine this to provide extreme value to the patient? I think the top right one is pretty cool because that's kind of like an indication of 3D printing of individual pharmaceuticals, pills. And so that's a convergence of different technologies out there. There's some form of biology, genetic information, as well as 3D printing integrated. All these things are possible, but not necessarily well liked in the healthcare space, and also have a problem to being introduced because there's a lot of people in there who may not benefit from that, who are actually making quite a bit of money and live from the old way that healthcare is being done. This is what I told you before, is this this chart, which basically said there's eight underlying factors that basically cause the development, or the major causes for 15 chronic diseases, with at the same time are causing 80% of all the costs that are associated with these chronic illnesses that develop. And we're dealing with the illnesses without actually, you know, addressing the chronic conditions or these drivers that cause these chronic conditions. And so I believe that we need to start also from the innovation perspective in asking, how might we actually reduce diabetes, or how might we reduce these costs of chronic illnesses by, you know, by doing certain things so that we actually don't have these issues anymore. And that will then be the starting point for democratizing healthcare and making health available and affordable for everyone. And the innovation process has to also start with, you know, rephrasing, sorry, it's wrongly said, not rephrasing that wording, but rethinking that wording. So this is something that I think probably relates to a lot of people on this call. It's like we all want to build a painkiller for a burning problem. But what we typically do in a healthcare space, or even from the research perspective, we build a painkiller, but we don't even understand the burning problem that we try to solve with it. And if we really go for, and let's go for the previous page, if we want to, you know, build something that addresses these chronic conditions, then we need to actually understand this problem first, and then build a painkiller for that. So address the problem space from the back by deeply diving into the problem space, rather than building something and then looking for this incremental space that this solution that we created will solve. And so I'm trying to at least teach it also to my students, is that I don't necessarily want to have a solution. I want to have a clear understanding of the problem, a clear understanding of what you would like to achieve, what your purpose should be, and then we can deal with the solution. Solution is easy as soon as you understand, or if you have a clear understanding of the problem and what the development or the future will actually bring to this problem space. So I'm pretty much done with this. So I'm closing it up, and maybe I even talked a little too much already, Oliver, but we had some time in between. I want to mention some of the forewords that were in this book. One from Peter Diamandis. I'm very happy to have him there as a forward writer. And he kind of like points out on this healthy longevity issues, that we need to do something to not only live longer, but live longer and healthier at the same time. And there's a lot of things that we need to get done for that. There's a lot of money, by the way, talking about profit and finances again, that are put into that space at the moment. You may say that that is not really for democratizing. You're probably right initially, but I believe that rich people that can afford that, they will have an advantage initially, but they will also lead the development, so it actually will then follow the exponential curve, and at some point in time will be cheap enough because of the volume that it will reach other areas and other population segments as well. I also have Marissa Shafi Ahmed in there, who is I would say, one of the best, most well-known surgeons in the world. He's particularly well-known in the UK. And he's also somebody which is interesting. He comes from Bangladesh originally, a fairly poor country. And he's now one of the top surgeons in the UK. And he is also very interested to, first of all, replace himself as a surgeon, if possible, and replace that with tools that provide equal quality at all the time. But he also is interested in providing solutions that reach also places like Bangladesh. And the third one I have in there is Professor Evelyn Bishop. She is a world-renowned health longevity expert. And she is going more into the biology of things and the cell part of things. And it's very interesting to see how interdisciplinary activities in that space are actually leading developments in health. So it's not the doctor. It's a combination of a biologist, an engineer, a computer scientist, and a medical doctor who create innovation in that space. I think that's a very important message also, that if we really want to do something impactful, we need to do it together in different fields. And I think that's probably almost one of the most powerful messages. So we have different parts in this book, starting off with what's wrong. So there's all in all 5 chapters. Then we talk about exponential medicine and technology mindsets that go along with that, and what the future health value propositions could look like. Talk about innovation, methodologies, more like from a basic concept. Have a fairly long chapter on ethical design considerations, very important too. We need to rephrase and rethink ethics and moral aspects on that, particularly with respect to data usage. And then go into how do we really do in innovation design and novel innovation design, and use the Purpose Launchpad as a base tool for that one. That needs to be combined, however, with educational aspects. What are future healthcare leadership skills? And it's not just following a pathway, but we need to actually probably learn something different, and learn different in school, and maybe have this lifelong learning aspect involved for everyone on I wouldn't say superficial topics, but everyone needs to have certain soft skills. Interdisciplinary problem solving was one of the aspects. Empathy is another one. All these things are getting more and more important in this world, and particularly with respect to health. I also, and that's the second to last part, I'm presenting, sorry, the health entrepreneurship is obviously a very important one, because that's one of the goals of the book, is to stimulate entrepreneurship and to give also some concepts of what needs to be done regulatory wise, from a concept point of view. And then we'll go over to present some of the incubators that are dedicated to health innovation, education, incubation. Also some corporates in there. There's General Electric presenting it, Siemens presenting something. And then the final one is just a summary chapter with all the tools and concepts that are around following that Purpose Launchpad health approach. I think I'm going to cut through this quickly. I just wanted to show you that's very small print, so apologies for that. But I just wanted to show with this here. These are all the co-authors that come from the EXO. Sorry, it was one too quick. Come from the EXO space. This is not including me. I'm obviously also from the EXO space. So if I would put myself on there, it'd probably be 3/4 of this book has been written from and with people that are part of this EXO community, which also should show how powerful this community is, and how valuable the input is, and how willing these people are to contribute to a book like that. Okay, so summarizing, and then I'm really finishing up. I think the key innovation principle of this book is you need to do some agile iterative approaches. Don't just follow an idea, have many ideas, have a 10 times thinking, not 10% thinking. That's the one leading to disruption. You need to, put people who are familiar with the EXO canvas and the EXO attributes. I believe that experimentation with all aspects, like, is it useful for the patient? Is it useful for the company? Is it useful for the country, for the population? All these types of experimentation are incredibly important. And we need to put a lot more empathy forward. to understanding the core issues as a patient. I'm not doing things or I don't want to do things for the hospital or for the doctor primarily. I would like to do things that benefit the patient. We should definitely not start before we understand the problems. We have to some of these things are quite obvious to everyone, but I think it still doesn't hurt to repeat them every once in a while. Ask a lot of questions. Focus on the learning rather than on getting something done that then later on is found out to be not very important or valuable at all, but focus on the learning. And I also believe that obviously you need to know in the medical space a little bit about regulatory, but regulatory is not in the center of attention of this book. It is something that is needed at some point in time, but if you know too much about regulatory, you may not want to do things in that space anymore because it's too restrictive at the end of the day. All right. So also these things are clear. Desirability, feasibility, and viability, sustainability need to be checked with health innovations. Very often not done, and very often not done on a global level, only on a local level. And that's why I mentioned them again. Okay. And all these things are also clear with the vision, mission. Everyone in this call, I'm sure, has been exposed to some of the teachings and discussions we have. That's why I don't want to focus on these ones as well. But I also can put quickly my hat on as not only an innovator, but also as an investor. And I would personally not invest in the healthcare space in topics and companies anymore that are having not a massive vision of how to transform and translate that space, but at the same time have some realistic mission statements or milestones of how to get to this massive transformative purpose. Okay, this one I stole, and then I'm really done. I stole from NextMed, from Daniel Kraft, also somebody who was in this space. As a little bit of a summary again, that we need to be bold to address the issues that we need in the healthcare space. And I hope that some of the things that I provided in this talk and that the book will provide with these 3 unique selling points have been at least somewhat stimulating. And I hope that there is some questions available or some questions in this call that I can answer in the remaining 7 minutes. So thank you very much.
Thank you very much, Michael. If you share your screen and we can have a big look again. First of all, for your information, I put the link to this book in Amazon.com in the chat. You can pick it up there. And also there was a question from Rand. He was asking earlier in your presentation, how do doctors help with this, how doctors will help in this sustainability, and is there any positive case studies?
I'm not sure that I understand the question correctly. I can tell you that doctors have a very important role, and they will have a very important role in the future. There is, at the moment, believe it or not, in most places in the world, even in the developed or high income nation world, we have not enough doctors, even though people complain about the doctors, getting too much involved. There's not enough doctors around, but we need to somehow make sure that the doctors are doing what they're best at doing. So the human component, a focus on the human component, but take all the things that, machines and other things can do, take that away from them. And basically have them focus on patient and have them focus on the entire journey of a patient. And in all honesty, let me say that as well. I personally don't want to ever become a patient. I want to stay healthy. I don't have an interest in actually meeting any doctors if I don't have to. So, but we need to probably have doctors helping us on this path as well, on the path of prevention and participation. So that's an important thing. Most of the doctors that I talk to are not that interested in what I'm saying, because at the end of the day, they believe I try to, or this book or this innovation tries to take their job away. This is not true. We actually try to give a lot of health information and health tools to populations and people that don't have it, and we try to actually improve their work. But if you ask a radiologist about helping to get rid of him, he will not agree with that, right? And so sometimes it's very difficult to get a doctor involved in these health aspects and have them as a very active participant in creating new innovation. I'm not sure that's what you were looking for.
May I?
No.
Yeah, may I ask?
Sure.
Yeah. Sorry, maybe my question was not very clear, but I understand what you said. Thank you so much. I mean, you know that also doctors, when they write like a medicine or something, they get benefit from that. Also the pharmacist and and all the people that, all the organizations that sell medications, and that will definitely decrease their profit if we are looking for sustainability, and doctors also will help in that. So how I don't know if you get me now, but how this will help also the pharmacists, the medical organizations, because this will decrease their profit and their.
Sure. But this is a major issue with this entire setup, is that the pharma companies only make money when you're sick and you actually require their pharmaca, right? The pharmacist only benefits from you being sick and actually going to the doctor, getting a prescription, and then going to the pharmacy and getting that pharmacy. And so this is a complete shift, and that's what I said initially. The patient is not in the center. The patient is basically a reason why these guys or these institutions, stakeholders, make money. I'm not trying to get, to basically be socialistic here and just take everybody away and just say that everybody is bad and evil. No, they're doing actually a job of treating you when you're sick, and I think that's a good thing, right? You don't want to. I don't want to shift everything to prevention and prediction. When you're sick, nobody's there anymore. But I think you could avoid a lot of these things. And most of these people just simply, or most of the institutions, benefit from you being sick. And that we need to change. There needs to be a benefit of the doctor keeping you healthy. And I don't have a solution for that. So I'm not saying that I know how to do it. But if you would, for example, pay, and I think there's some nations who have some ideas. If you pay, you basically are assigned to a doctor, and if you never see the doctor gets money for you not going to the doctor because you're healthy all the time. That could be a completely different thinking process of incentivization. Pharma companies, they have much to lose. They have also much to gain, because I firmly believe that prevention, or having information about what could happen to you, could also trigger a new pharmaceutical solutions that help you actually never getting that disease. So I believe that pharmaceutical companies could actually benefit from that. I also believe that in a lot of countries, pharmacists could benefit, because they are, to a certain extent, I would say that doctor equivalent, but for 80% of the cases, if you have an easy flu or something like that, why do you have to go to sit in the doctor's office and get a prescription? Why can you not go directly to a pharmacist? In some countries, you can do that. In Germany, you can't. You have to go to the doctor first and get a prescription done. But the third question I have to ask is, how many of us do really use pharmacies the way they were intentionally made for? You have some consultation with the pharmacist, some discussions. I order everything that I need. If I need everything from an online pharmacy, I don't need to have any discussion with a pharmacist. So the question is on whether that is actually future-proof, this kind of business.
Yeah, thank you.
Thank you, Rand. There was one more question from Suman. Have you used any of Atul Gawande's work? I
don't even know this person, so I could quickly say no. But that just means, Suman, that I'm not necessarily always informed about all these things. I mean, you can read only that much stuff, yeah. So no, I'm not.
No, not an issue. It's just that this is more in the US context. Mm-hmm. He's a medical doctor, but he really works at the policymaking level, and trying to change the system at a very big level. might want to just check it out in general.
That's cool. That's cool information. I mean, at the end of the day, we need to have like an alliance of willing people. And I know in the I'm in a journal editor. I'm part of the journal editing team. It's a journal called Artificial Intelligence Surgery. So it's not artificial intelligence in surgery. It's called Artificial Intelligence Surgery. And the goal of this is, and it's mainly run by surgeons, where they say, we need to actually create tools to get rid of us, so they were not needed anymore. And I thought that was a really cool thinking process. And that's a very interdisciplinary team. There's economists there, there's health policymakers in there, there is obviously scientists in there, and there is surgeons that are saying, what can we do? How do we have to employ artificial intelligence so these systems can run without us? I thought that was a cool thinking, but not a lot of people think that way.
Yep.
We're on the top of the hour. One important last question from anybody?
No.
In this case, thank you very much, Michael,
Welcome.
for this really great masterclass, getting insights into the future of healthcare and how we can get there by using, well, the tools that we obviously have in hand, but we have to use it.
Yeah.
Thank you so much. And
Welcome. And again, if you, I'm sure that if you, maybe you want to put, Oliver, you want to put your email in there, and then if people send you a request, you can get the presentation. And
what I would actually put a posting in the community circle in OpenExo, and we'll attach the slide deck. And as I said, if you take a chat, there is the link to the Amazon.com book if you want to order it, and of course it's available in many of the local stores as well. I just posted it once more into the chat.
And if you don't want to order it, I'm quite happy with this as well. So it's I will eventually post some of the content. I'm very happy with and thank you very much, Oliver, for contributing a couple of the chapters on this one. So I'm very happy for that as well. And thank you for the community of providing the input that was necessary for this interdisciplinary book.
So that was just an announcement that Michael will keep posting on LinkedIn a couple of these chapters. So if you want to collate the book,
I'm sure that I'm not allowed to do this. Springer will probably kill me when I do this, but
no, it's the only part.
Yeah. Maybe at least the abstracts.
Exactly. Okay. Thank you so much. Enjoy the evening, and well, see you soon. Bye-bye.
Bye.